Sometimes healing asks us to do something unexpected. Not push harder. Not give up. Not figure everything out. Not fix everything immediately, but simply be. To make room. To soften. To listen. To allow. To trust that not all healing and wellness emerge from effort. Some healing emerges from creating enough space for the healer within to do what it has been trying to do all along. We carry many things: responsibilities, expectations, old stories, unfinished grief, fear, pressure, the weight of what has happened, the weight of what might happen, the weight of what never happened, the weight of what we believe should have happened by now. Sometimes we become so accustomed to carrying these burdens that we stop noticing their weight. We assume the tension is normal, the worry is normal, the overstriving is normal, the vigilance is normal. Yet carrying is not the same as healing, and effort is not always the same as progress. Letting go is often misunderstood. It does not necessarily mean abandoning what matters. Sometimes it means releasing the struggle around what matters. Sometimes it means putting down what was never ours to carry. An expectation, a timeline, a fear, a need to control every outcome, a belief that healing or anything else we deeply desire can only happen if we are constantly doing something. There are moments in life when letting go is not loss. It is resolve. It is relief, not self-abandonment, but surrendering the illusion that we must manage every detail of whatever is unfolding. Many of us believe there are only two choices: push harder or give up, fight or quit, control or collapse. But there is often a third path, a quieter path, a path that asks us to become still enough to perceive, to hear, and to understand, to notice what was previously overlooked, to hear what was constant activity may have been drowning out, to understand what might be trying to emerge, because not everything requires a constant intervention. Sometimes being means doing nothing, not because we are passive, not because we have given up, but because we recognize that some processes unfold best when we stop interfering. Sometimes we just watch. Sometimes we wait. Sometimes we observe as things unfold. Be it healing, business, careers, relationships, seasons of life, even the broader social and political climate around us. There are times when wisdom asks us to act. And then there are times when wisdom asks us to become still, to see what is already moving, even when our mind is not yet able to perceive the motion. Seeds germinate beneath the soil long before they break through the surface. A wound begins repairing itself long before we can see the change. Sometimes movement is occurring beneath the surface because our senses are not able to detect it yet. The question is not always whether something is happening. Sometimes the question is whether we are patient enough to allow it to unfold. Healing often begins long before anything visible changes. A shift in perspective, a shift in attention, a shift in what we believe is possible, a shift in what we are willing to release, an internal softening, a willingness to see through things differently, a willingness to stop fighting every moment of uncertainty. These shifts are easy to overlook because they are often invisible. Yet, they can change the direction of an entire life. Sometimes the most important movement is not external. Sometimes it happens quietly within. Within silent medicine, I often speak about the healer within and the Most High, the wisdom that exists beneath fear, distraction, and constant striving, the sacred guidance that becomes easier to notice when the body is calmer, the mind is less crowded, and the nervous system is not living in constant urgency. The healer within is not something we create. It is something we learn to trust. Our bodies are constantly adapting, repairing, responding, communicating, seeking balance, seeking wholeness. The question is often not whether the healer within is present. The question is whether we are creating enough space to hear and to support its work. Trusting the healer within is not passive. It is an act of internal resolve, a willingness to remain present, a willingness to listen, a willingness to honor what we are noticing, even when evidence has not yet caught up with what is unfolding. Perhaps healing is not always about doing more. Perhaps it is not always about finding the right answer, fixing the problem, or forcing the outcome. Perhaps sometimes healing begins by putting something down. A burden, an expectation, a fear, a story. And in that newly created space, something remarkable becomes possible. The mind becomes quieter. The body becomes less burdened. The heart becomes more available. And the healer within has a little more room to work. In my experience, I have rarely found perfect solutions, but they are often resolutions waiting when challenges rear their head. May we remember that not all healing comes through effort. Some healing comes through making room. And sometimes the most courageous thing we can do is simply be. If this resonates with you, you can find more reflections at silentmedicine.com/reflections and podcast conversations at silentmedicine.com/podcast.